most famous physical therapist on the internet.
Hi, folks. I'm Bob Shrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So we're all about easy, Brad. Today, we're going to show you 3 easy stretches for low back pain. We're going to break down just as part of the 3 best ones.
Right, and we'll explain this in a minute.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, if you go to Bob and Brad, there's a lot of things there, but we do a giveaway every week. And this week, we are giving away a blood pressure cup, a Bob and Brad blood pressure cup, by the way.
And it's got our name on it. It's a good cuff.
It's a good cup. They did research on it, Brad, that was accurate.
Right.
So you can also find the contest. It'll be pinned to the top page of Facebook. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. I just saw a comment, Brad, where somebody was complaining that we got to get on with it, go with it.
Yeah.
And I said to him, go to our 60-second one program.
Yeah, go to 60 seconds.
You don't have to put up with us talking.
Some people say they like to babble. Anyways, we also have a podcast going on out there with a number of excellent interviews. And we have the interview of one of the people we're going to talk about for these back pain stretches. So are we done? Can we get on with low back pain, 80%. And this varies, but somewhere around 80%, depending on the study, of people across our society experience low back pain throughout their life.
I think it actually, Brad, was low back pain to the point where they can't go to work that day or something like that. It was that serious. It wasn't just back pain. It was to the point where they couldn't work for a while.
Some people won't go to work.
Yeah, I know.
Anyway, no, seriously, back pain, everyone has it sooner. Not everyone. Most people do. Most people. So anyways, it's something that if you can learn some stretches that are easy and effective, particularly do them as maintenance before the back problem comes along. And that's where, and these stretches came from 2 of the best well-known physical therapists. And
one's a PhD.
And one's a PhD.
Yep.
And the other one, is Robin McKenzie. He doesn't have his PhD, but he's got about 60 years of... he dedicated his whole life to back treatment. And Stewart McGill, the other one, he's got his PhD, and he also dedicated the vast majority of his professional life. And that's where we came up with these 3 exercises. So listen closely to them. They're easy, and they're not... It's something you can do. The first one, should we get right on?
Yeah, let's get right on.
You want to lay down. Sure. You can do this one in bed. Actually, before you get out of bed, it only takes about 30 seconds.
This one's really pretty easy on people. Most people can do this one. So you're going to put your feet together. I got my ankles together, and I'm going to rotate back and forth. Now you think, that's not moving the back. Yes, it is. You're actually moving the hips.
Yep.
So it's actually good for arthritic hips too.
Right.
But it's also rotating the back, getting a little, motion in there.
Yes.
Probably a little synovial fluid in the joints.
Yeah, so notice he lets his hip come up here, and now watch right here. This hip actually comes up off.
But my shoulders stay down.
Right. And that's where you get that rotation.
Like that, yeah. And if it hurts one direction, you're not going to go that direction to start. So let's say mine hurts to go into the right. I'm just going to work it going to the left at first. And then every once in a while, I'll try the right and see how it's doing. So, great one to do. You can do it for 5 minutes as long as it's pain-free.
Right.
It's a great warm-up for getting out of bed in the morning.
Absolutely. So there you go. And throughout the day, if you want to lay down and do that one, or when you
lie down. You were doing so well, Brad.
I know. I got the English major.
We're sorry, Karen.
Yeah, Karen. She's been working good with us too, and
I
let her down. Number 2, prone press-ups. This one, Robin McKenzie kind of has got the credit for, and there's a little discrepancy between Stewart McGill and Robin McKenzie. So we're going to just show you.
We'll show you both ways.
Right, yep, and explain to you how
McGill does not believe in these full prone press-ups.
Right.
We have used it with patients for many years. I'm trying to push my pant leg down.
And I'm still going to use it if it gives me really good results.
Well, I do them as a maintenance.
You do, yeah.
I did them this morning. So
what are we talking about? Laying on your stomach?
Lying on your stomach.
Lying.
Put your hands underneath your shoulders. And, if you want to do kind of in between, you could do a micro press up.
Sure.
Most of you are going to want to do that to start anyway. And you don't want to lift up your pelvis.
Yeah.
You're trying to get motion in your back.
So
Now, the key with all of these, if you're not having any pain, then you can go up as long as it doesn't give you any pain.
Right.
But if you are having pain, this should be making your pain better, especially if it's down the leg. The pain should start retracting, going up the leg,
right,
to the point where you don't feel it in the leg anymore. Maybe you feel it in the butt now, and then maybe no longer in the butt, but in the back. So
yeah, sometimes they call it centralizing.
Right.
I did want to say you can do this one on a bed. It works best on a firm surface. Yeah,
right.
On the floor is probably better. But if you can't get on the floor, the bed is okay.
So now Stewart McGill, what he recommends instead is just first off lying prone, and then you might even go with this double fists.
Yep, like under the chin.
I believe he even gets to the prone position.
I think that prone
and like that.
Yeah.
You move the neck up a little bit.
Sure. You ever do this one?
No, I haven't.
Yeah.
That was Mackenzie, wasn't it?
Yeah, but I think Stewart wouldn't mind.
No, exactly. I think it was like this, right?
Well, it depends how high you want to get.
Right.
Whatever you're comfortable with. But the whole idea is that the back is extending, and you need to do it so it makes things feel better. Sometimes you go up a little bit and it hurts, but if you leave it there for maybe 20 seconds and the pain settles out and goes away, that's a good sign. If it gets worse after 20, 30 seconds, then you got to go back down.
Little evidence too, Brad, that and I saw this in a live patient. He actually would get in this position and then he'd rotate back and forth a little bit.
Yep.
And it would kind of readjust things and it would feel better. And Dr. McGill, when we interviewed him, we kind of alluded to that too by saying he would actually pull on people's legs.
Yes, a little traction.
And rotate it back and forth. So try it either way. It's always, don't increase your pain if you're having pain. It should feel better.
Right. Otherwise, go to the next one. That's why we got 3 options.
Right.
Here. So what am I doing? The
cat
and camel. Now, some people call this other things, don't they? Like the cow or the horse or something.
So I'm basically bringing my head down and arching my back up.
Yep.
And then I go the other way where I bring my head up and I'm creating an arch in my back.
And again, you can do this one on a bed. Probably the floor is better if you're able to easily get up and down. But basically what you're doing is you're ranging out your spine in both directions. Now, if you have pain in one direction, don't push into it. Just stop and go back up. Or if it's at the top, go back down. And again, it should feel better as you do. You're going to do about 10 of these.
Right.
And it should feel better as you do more. It should feel like it's loosening up and things are getting good. And when you're done, it's like, oh, that was good.
With all of these, Brad, I would say you can do them throughout the day.
Sure.
You can do them up to, like Mackenzie would say, 6 to 8 times a day.
Yep.
In fact, he'd highly recommend that because you do it once, it's not going to make a big deal, make a big difference. But if you do it throughout the day, things start to get better.
Right.
So,
and again, even the first time you should notice, oh, it does feel better. That's for sure when you want to get back with it. But you're not going to do that for the rest of your life. And when your back starts feeling better, then you can go to once a day.
Once a day or even once every few days,
depending
on, how it works for you.
Yep.
So, and I will also say, Brad, you don't necessarily have to do all 3. If you find one that really works for you, stick with that one.
For example, me, I won't do prone press-ups. I won't do that because of my back condition. It just irritates her all the time. So the
Brad has spondy. I'll let you say it.
Spondylolisthesis.
And that is not recommended for spondy. And neither is spinal stenosis. You don't want to be doing prone press-ups.
And you'll know because it hurts.
Yeah, you'll know.
The more you do, the worse it gets. So you just don't do it.
It's no pain, no gain is not the statement we're making today. You want no pain.
Right, exactly.
All right.
But wait, Bob, there's more.
There's bonus information today.
That's right. This is, I think, pretty much Mackenzie as well as McGill.
Yeah, this is
Get
universal.
Out and walk.
Right.
And it's best to walk on even surface, not in the forest or through the field.
Right, on level surfaces or hills.
On level, don't avoid going up and down, or avoid hills and things like that. And yeah, definitely that. And then posture.
Even so, well, I was going to say, even sometimes it feels better to walk at a higher speed, believe it or not.
Oh, yeah.
If you walk at a low speed, it puts more pressure on your spine. You walk at a higher speed, it actually it takes some of the weight off your spine.
Yeah.
And so people actually walk better sometimes when they have back pain if they walk a little faster. Also, Stewart McGill would recommend like 4 times a day, like, after each meal, and then maybe one other one, where you actually go and get a 15-20 minute walk. I just had my nephew do this. He was having some sciatica, and he did best. He walked all the time. And
he's a student.
He was a student, so
no car.
Right. So it helped.
But anyways, do what you can and make sure your posture is good. Use a lumbar support. Monitor their posture so this kind of thing is not happening, which can happen without even being aware of it. So, somebody in their house, if you're slouching, have them come up to you and give you a little hint. Sit up tall, young man.
So Stewart McGill says, the number one thing you want to do is stop the cause. When you're having back pain, a lot of you think maybe I'm having pain all the time. It's just not true. There's always a cause if you can figure it out.
Right.
And if you can't, you might want to get Stewart McGill's book.
Right.
The Back Mechanic.
And if you have to resort to, seeing a therapist.
Right.
Yeah, just don't see us.
Yeah. All right. Good luck to you.